Well, hello. I am here with Melinda Montoya. My name is Douglas White. I am uh, with the Scope of Practice Task Force of the American Academy of Orthopedic Physical Therapy, and we're doing a series of interviews on PTs practicing in rural health. So with that, I'd ask Melinda to introduce herself and tell her where she's at and what kind of practice she's in, and um, go from there. Thank you.
All right. Hi, my name is Melinda Montoya. I'm a physical therapist with the VA home-based primary care program. I am their rural outreach therapist, so works perfect for this. Prior to working with the VA, I was with the Indian Health since 2015 and worked in Chinle, Arizona, and in Shiprock, New Mexico. And post-graduation, so 2014, I was in Socorro, New Mexico, an area that served a catchment of 200 square miles in terms of resources, so incredibly rural settings.
Well, that's great. And what do you find rewarding about practicing in rural health?
Uh, it's so much. I mean, you have to have a good toolbox at your disposal in terms of like really what you're seeing. Uh, in At least on the reservation, I got to see a lot of things that were in your textbook, and they're like, you'll only see this in the textbook. But we saw a lot of Charcot, a lot of gangrenous limbs, and got to work with lots of different providers that really wanted to help elevate our skill set to better serve the population. But you just have to be a little bit of a jack or a Jill of all trades within like the practice, like IDing neurological changes, orthopedic, addressing pelvic floor dysfunction and if case warrants, and then having a good grasp of like even pediatrics if you're more in like a solo therapist in like that large setting. So just having a little bit of everything keeps you on your game. It's very interesting.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With gait analysis, continuing education, and technology, RunDNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
What could you say to PTs thinking about practicing in rural health? What kind of things could you encourage them about, or what they should be looking at when they're thinking about that?
I mean, I think there's like a lot of push for like financial reimbursement, especially for providers. I think that's like a big thing, especially with our student loans and everything else. Rural health actually does provide a lot of incentive for young therapists to go out there and practice in those settings. I mean, from loan repayment to public loan service forgiveness. And then if you're working in like another setting, like I am within like the federal sector, there's even more incentive if that's part of it. Another thing is for providers, maybe just kind of recruiting from communities. I am big on that. Like, especially I'm from a really small rural community. And so sitting and coming back to like rural health is really, really important to me to serve these underserved populations. So I think it's part of like our recruitment on like students and everything else, and like having a good grasp of can we get people that match these communities coming into programs. But I also think it's just getting out there, really encouraging good student rotations where they get to go into rural settings so they have exposure. I know a lot of my students didn't have any exposure to any rural settings. So when they came, they're just like, oh Lord, we're in the middle of nowhere. But once they got used to like the flow and everything, like it was absolutely interesting. And I still have students that reach out and will talk about cases. And I saw something maybe similar in like a SETI setting, but this is the A, B, and C on how we treated this patient because we have more resources compared to what you guys had. But I think there's a lot to be said to getting to be a rural therapist. And I feel like certain states are doing more for expansion of practice. I know New Mexico is trying, and that gives people a little bit more breadth of what they're doing instead of being under just like an outpatient setting. And you're just being told, okay, here's your total knee, here's your plan of care, and you just do, and not really having that capacity or ability to think outside the box because you're kind of deemed by what the insurance in your hospital settings having you do. I'm not saying there's no rules in rural. There's absolutely rules because you have to still always provide the highest level of care, but you have to just think so much bigger for people compared to like if you were just doing outpatient setting where it was a very controlled situation. Hopefully,
Yeah, that's
like verbally just throw out a bunch, but like now that I'm with the VA home-based programs, it's interesting. It's like it's not quite home health, it's like primary care setting physical therapy, and we're getting to really see people go into the homes, make recommendations across the board from like they need X, Y, and Z to be safe in their bathroom, and we're able to order and really connect them with that equipment. And so I know the VA is doing something similar. Kaiser Permanente in California has something kind of like a home-based or a primary care PT embedded in their systems. And I think that kind of goes hand in hand with rural healthcare. We have to be much more independent practitioners when we're out in rural settings without really having the support of additional staff or providers to help give us guidance like on the regular.
Yeah, that's great. I agree with you wholeheartedly. It really is, primary care is a big part of the way that we practice in rural health. The two are definitely linked. You see any other systemic challenges to rural health or anything along those lines that is kind of unique to your area?
I feel like for us, like a lot of it is like hospital-based settings. So like if there's some private sector, like I'm gonna think of like my small town that I'm originally from, Socorro. They have one hospital that serves, like I said, a casement of 200 square miles, like from Tennessee to Catron County. It's like this huge radius that they take care of. And so they have the hospital, they have the emergency system, they have a small outpatient clinic, but if a therapist goes and works with them, they're kind of like protected with this nonprofit. But they do have two other outpatient clinics, but they have a hard time recruiting therapists there because they don't get the benefits of being connected to a nonprofit and getting like the loan repayment and all this other thing. So the the private sector people have to pay extra or do some kind of their own like recruitment loan incentive to get people in. So I see that's something that's pretty systemic because we only have a few big hospital systems in New Mexico and very few people that are now willing to take the risk to even do private, especially with like reimbursement cuts and everything else. So we're kind of seeing like the private sector kind of dwindle, and it's getting bought out by like big box therapy groups. And it's just kind of like this churning that's happening, not just with patients, but even with providers just getting burnt out, leaving the system, and there really isn't good support for them. So I mean, we're trying to find ways like with our APTA New Mexico group on how do we keep people in New Mexico and help support rural therapists, like either through education, mentorship, whatever they might need. But it's a hard sell when they financially can't be there. And housing, like if we do recruit somebody in, like these rural areas don't really have stable housing markets for rentals or anything like that. And certain places like Roswell, New Mexico, because of like oil country, but it's still super rural. All the housing is pretty much bought out by these oil magnates that are like, we're going to implant all of our employees there. But to get healthcare providers in, it's astronomical to ask them to rent. It doesn't even make sense. So they really have a hard time recruiting. So we're kind of coming up with like, it's not just systemic, it becomes like more of like this grid system issue, like across the board. So I guess, yeah, systemic, it's really deep. Cultural value shifts.
Yeah, I can understand that. And if people can find the right spot that works for them, it's very rewarding. You agree? Yeah.
Save the date for the 2024 AOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit aaompt.org for more information.
Well, that's great. I really appreciate getting your perspective from rural New Mexico and all that. And um, we'll look forward to publishing the article and seeing how things work out.